your phone died.
All right. So a very good evening, everyone. So this particular session, it is mainly to help you, like what exactly you have to read in the last 6 to 7 days just before the exam related to general medicine. So I'll mainly concentrate on what are the topics that you have to read. Just 1 minute. Right. So I'll mainly concentrate on what are the topics that you have to read in general medicine and what is the time that you need to allot for reading these particular topics every day. Right. I'll be discussing in just 10 or 15 minutes. I'll not take much of your time because each and every minute is very important at this moment. So I'll take just 10 or 15 minutes and I'll just give you a brief review of like what are the topics definitely that you need to read just before going to the exam related to the general medicine. Okay. Right. Just before starting the topics, the new pattern that has come up is like we have 200 questions which have been divided into three sections, that is A, B, C. I hope like everyone is aware of. And for each correct answer, you'll be having like 4 marks plus, and for every incorrect answer, you have negative marking also. Please remember that. And if you did not answer, it will be like marked as 0. And in these three sections, the first section is anatomy, physiology, and as well as biochemistry. This, it will be carrying around 50 marks. Section B will be pharmacology, microbiology, pathology, forensic medicine, and SPM. This you will be for the 100 marks. And section C is very important, which will be carrying around 150 marks, in which you have medicine and allied subjects, surgery and allied subjects, obs and gynae, ophthalm, pediatrics, and as well as ENT, right? And the next important point is the entry into the examination hall will be closed by 8:30 and login access will be given at around 8:45. Instructions will be available on your screen at around 8:50 and exam will start at 9 a.m. Exam will end at 12:30 p.m. Right? Now, having said up, and one more important point, just identify your exam center one day before. That is 23rd is the exam. Please identify your center on 22nd itself so that the last moment panic and as well as anxiety can be avoided. That is very, very important, right? And next is you need to know what are the last 7 days agenda for the good Neet PG score. First and foremost, very important is consolidated learning. Don't read anything new now. Whatever you have read, please read it in a concised manner and try to restrict your preparation mainly to the PYQs and in and around the PYQs. And revision of this short notes, whatever you have prepared is very important. And try to highlight what are the silly mistakes that you are doing. And please try to avoid that common mistakes or the silly mistakes that you are doing. And next is whenever you are writing the exam, there will be overthinking. Please avoid overthinking, right? And whatever the answer you get in the first instinct, please stick to that particular answer. Avoid overthinking and avoid unnecessary confusion in the question which you already know, right? And next important is what the Neet PG aspirant must avoid in the last week. So please don't read any new information now and avoid unnecessary anxiety and as well as panic by comparing with others. Definitely, it is very much natural to feel restlessness in the final stage of the exam, but you must attempt to keep yourself composed. That is very important. Next is you should be confident while giving the exam, but please don't be overconfident. And at the same time, overstudying. Just before the exam, it is very much natural that you will feel extremely pressure to perform well. So thereby you will be reading excess number of hours, compromising your sleep. Thereby what will happen is there can be health issues, there can be excessive fatigue, and that will lead to poor performance. So don't do overstudying, right? 6 hours of sleep is very important at this moment of time. and avoid all the distractions, right? Social media's distractions, video games, chatting apps. In these final days, it is not at all advisable, right? Because this opportunity will not come back till next year. So this exam, whatever you are giving this 23rd, will be there only this year. The next opportunity will be there for next year. So please avoid the distractions in the last 5 or 6 days. Now the question comes, can the magic happen in the last 7 days of Neet PG 2024? Right? What I will say is yes. Right? Why I can tell you is, if you have well prepared for the exam, then it is just only the revision which is required in this last 5 to 6 days. So the magic can definitely happen in the last 5 to 6 days also if you revise properly. Now, already if you are getting a GT score of more than 500 plus, then that is considered as a good score. So be confident enough, definitely you will be clearing the exam. Now, what are the types of the questions that can be asked? Very important is the clinical based questions, then image based, assertion and reasoning questions, and as well as the single best answer questions. Now, what are the topics that definitely you need to revise just before going to the exam related to the general medicine? Right? So what I have done is, right, the topics that have to be definitely revised before going to the exam. Right? Number one, I have just divided the topics in the form of dates and how much time you need to allot in a day. Right? For cardiology, tomorrow you try to allot 2 to 3 hours. And what are the topics that definitely you need to revise? One is the arterial pulse. I don't say that you should revise the entire thing. Abnormal character of the arterial pulse. Then in the murmurs, you try to revise the dynamic auscultation. In the JVP, the abnormalities of the waves, you should definitely revise. Then in rheumatic fever, the modified Jones criteria, major and minor criteria and diagnostic criteria, very important. And infective endocarditis, the recent guidelines, modified Duke's criteria, and in which conditions the prophylactic antibiotics is required, that you should definitely revise before going to the exam. And in the congestive heart failure, you need to know the treatment. That is heart failure with preserved and reduced ejection fraction. What is the treatment that you need to give? And in the cardiomyopathies, very important is peripartum cardiomyopathy and Takotsubo cardiomyopathy. And in pericarditis, constrictive pericarditis, hemodynamics is very, very important that you need to revise before going to the exam. And cardiac tamponade, that is Beck's-Triad, definitely you need to revise before going to the exam. And regarding the ECG, arrhythmias you have to revise. And in ischemic heart diseases, you need to know the treatment. What are the indications for thrombolytic therapy, and what are the indications for PCI, and what are the indications for coronary artery bypass graft? So these things you have to revise in cardiology tomorrow by allotting the time around 2 to 3 hours. See, in the last 5 to 6 days, your timetable is very important in this last 5 to 6 days. So how is that you need to divide in the last 5 to 6 days is, you take one large subject, right, and one medium sized subject, and then one small subject. Okay, so large subject you allot a time of around 3 to 4 hours, and medium sized subject you allot the time for almost 2 to 3 hours, and small subject try to allot for 1 to 2 hours, right? And last 1 to 2 hour, you just keep it for the revision of the difficulties, whatever you feel in that particular day. So in that way, you see, you are trying to spend almost 12 to 15 hours in a day, right? So this is on 18th. Then on 19th, please revise neurology. In the neurology, what are the definite topics that you need to revise is the brainstem stroke syndromes, that is midbrain stroke syndromes, Pontine syndromes, and medullary syndromes, right? Midbrain stroke syndromes, there are totally 5. Pontine syndromes, very important, there are 4. Medullary syndromes, there are important 2. So you have to revise before going to the exam. Next, regarding the multiple sclerosis, McDonald's criteria, investigation of choice, and treatment. Right? It is not only drug of choice, methylprednisolone, that you need to know. What are the drugs that are given for maintenance therapy for multiple sclerosis also you need to know. Next is treatment of Parkinsonism. Many a times the question have been asked on the deep brain stimulation. So please try to revise what are the indications for deep brain stimulation and where is the electrode that you place for the deep brain stimulation. Next is the Guillain-Barré syndrome and as well as the myasthenia gravis. In Guillain-Barré syndrome, you need to know the investigations and treatment and types of the Guillain-Barré syndrome. That is AIDP, Aman, Asman, and Miller-Fisher syndrome. And myasthenia gravis, neuromuscular junction disorder, you need to know what are the presynaptic and postsynaptic. That means myasthenia gravis and Lambert-Eaton myasthenic syndrome, the differences are very, very important that you need to revise. And the spinal cord disorders, Brown-Sequard syndrome, conus medullaris, cauda equina, you need to revise. Meningitis, the table, bacterial, tubercular, viral, fungal, and Guillain-Barré syndrome, what will be the CSF analysis? That table is very, very important. And subarachnoid hemorrhage, what is the investigation of choice? How do you manage? Then ischemic stroke, what is the indication for thrombolysis? And what is the golden period for thrombolysis? What is the dosage of the thrombolytic agent? So these are the topics that you need to revise in the neurology on 19th and allot 2 to 3 hours for the quick revision of these particular topics. And next is on 20th. See, nephrology and as well as the connective tissue disorders. These two are small topics. So 1.5 hours for nephrology and 1.5 hours for the connective tissue disorders. And what are the topics that you should definitely revise in the nephrology? Examination of the urine, that is hematuria, proteinuria, abnormal casts, very, very important. Next is acute kidney injury, chronic kidney disease, diagnostic criteria and treatment is very important. Then nephrotic and nephritic syndrome. What is that you should read in nephrotic and nephritic syndrome? You need to know the renal biopsies of all the etiologies causing nephrotic and as well as the nephritic syndrome. So nephrotic syndrome, minimal change disease, diabetic nephropathy, focal segmental glomerulosclerosis, membranous glomerulonephritis. What will be the renal biopsy picture and treatment? Then nephritic syndrome, post-streptococcal glomerulonephritis, IgA nephropathy, Good-Pasteur syndrome. What will be the renal biopsy picture and what is the treatment? And exam will not be there without ABG. Definitely you will have 1 or 2 questions on the ABG. Please revise the ABG. And regarding the electrolyte abnormalities, you need to know the corrections. Sodium correction, potassium correction, magnesium correction, calcium correction. How will you do? That you need to revise before going to the exam. Renal tubular acidosis 1, 2 and as well as 4. Where exactly is the defect? What is the treatment? Then congenital disorders of the kidney. That is Bartter syndrome, Gentleman syndrome, Liddle syndrome and as well as the Alport syndrome. These 4 syndromes you have to revise. So these are the topics in the nephrology that you should definitely revise. And the time that you should allot is only 1.5 hour. That is on 20th. And on 20th, because nephrology is small topic, you take another important small topic that is connective tissue disorders. You allot 1.5 hours for the connective tissue disorders. And what are the topics that you should definitely revise in the connective tissue disorders? That is rheumatoid arthritis. I don't say the entire rheumatoid arthritis. One is deformities in rheumatoid arthritis, extra-articular manifestations in rheumatoid arthritis, diagnosis and treatment. These are the things that you need to know in the rheumatoid arthritis. And SLE, the serology is very important in the SLE. Most specific antibody, most sensitive antibody, the antibody which will tell you about the CVRT, APLA syndrome, what is the antibody, photosensitivity, what is the antibody, drug-induced lupus, what is the antibody, cerebral lupus, what is the antibody, psychosis, what is the antibody. So serology is very important in SLE. Next is multi-system involvement is there. So clinical manifestations and as well as treatment. In the treatment, everyone is aware that drug of choice is methylprednisolone. But there are certain clinical conditions in SLE where non-steroidal treatment is required. For example, you take lupus endocarditis, you need to do valvuloplasty. There the steroids are not, steroids will not be useful. So you need to know the conditions where the additional treatment is required apart from the steroids in SLE. Next is vasculitis. Already you will be learning the vasculitis in the pathology. But in the medicine, you need to know the treatment. Takayasu, what is the investigation of choice and treatment? Giant cell arthritis, what is the investigation of choice and treatment? Kawasaki, investigation of choice and as well as treatment. Heenan-Schönlein purpura, investigation of choice and treatment. Church-Strauss syndrome, investigation of choice and treatment. Microscopic polyangiitis, investigation of choice and treatment. Vaginous granulomatosis, investigation of choice and treatment. Right? Then, next important topics in the connective tissue disorders are sarcoidosis and scleroderma. Sarcoidosis, you need to know the investigation. Investigation of choice, that is your biopsy. But you need to know gallium-67 scan. You need to know the X-ray. Along with bilateral hilar lymphadenopathy, you have that 1, 2, 3 sign or pawnbroker sign that you need to know. And next is treatment. Next is scleroderma. You need to know what is diffuse scleroderma, what is limited scleroderma, what is localized scleroderma. Right? These 3 things you need to know regarding the scleroderma. And what is Raynaud's phenomena and what are the various causes of the Raynaud's phenomena and treatment for scleroderma. And next is seronegative arthritis. In the seronegative arthritis, ankylosing spondylitis. In ankylosing spondylitis, very simple, articular and extra-articular manifestation. HLA-B27 will be positive. Treatment is very important in ankylosing spondylitis. And X-ray. X-ray of the spine and dagger spine is very, very important in ankylosing spondylitis, and you need to know what is that. Then another important forms of seronegative arthritis is psoriatic arthritis. That psoriatic arthritis, X-ray of the digits is very, very important. And there is involvement of distal interphalangeal joints in psoriatic arthritis. Then you need to know reiters or reactive arthritis. That is also seronegative arthritis. And in that reiters, you need to know what is a triad. That is like arthritis, urethritis, and as well as conjunctivitis. And what is the dermatological manifestations in the reiters. So connective tissue disorders, these are the topics that you need to revise. That is on 20th. So on 20th, you need to revise two important things. One is nephrology and the other one is connective tissue disorders. Then followed by that, on 21st, you need to revise the pulmonology, right? So the pulmonology, what is very important is the pulmonary function test. Mainly in the pulmonary function test that graphs obstructive pattern, restrictive pattern. If there is presence of extrathoracic obstruction, if there is presence of intrathoracic obstruction, what will be the graphing? The pulmonary function test. That is very, very important that you need to revise. Next is the pleural disorders. Pleural effusion, pneumothorax. How will you diagnose? What will be the X-ray picture and treatment? Then ARDS, treatment of ARDS, that is mechanical ventilatory settings in ARDS is very important that you need to revise. Next is treatment of pneumonia, right? That is your curve 65 score is very important. You need to know how to apply the curve 65 score when a clinical scenario is given to you. Then COPD and as well as tuberculosis, COPD and bronchial asthma, the gold criteria in COPD, new management strategies in bronchial asthma, very important. Next, categories of the treatment in tuberculosis. Category 1, multi-drug resistant tuberculosis, extended drug resistant tuberculosis, investigation of choice, total drug resistant tuberculosis, and new treatment options for tuberculosis. This you need to revise. Then bronchogenic carcinoma, what are the various subtypes? And you need to know in and out about small cell carcinoma or oat cell carcinoma, and you need to know about the Pancoast tumor, and you need to know about the ectopic hormones which are being produced from this bronchogenic carcinoma, right? And you need to know SVC syndrome, right? Then obstructive sleep apnea and as well as how to diagnose polysomnography and how will you assess the severity on the polysomnography. And in the treatment, it is not only just CPAP, it is the surgical treatment, that is uvulopalatopharyngoplasty. So these are the things that you need to know in the pulmonology that you need to revise on 21st. You try to allot 2 to 3 hours for the pulmonology. And on 22nd, that is just one day before, try to revise your endocrinology, and which are very important are the pituitary disorders. In the pituitary disorders, you need to know the diagnosis and treatment. What are those? Diabetes insipidus, SIADH, acromegaly, prolactinoma, hypopituitarism. How will you diagnose? Treatment. And next is Cushing's. In the Cushing's, you need to know that flowchart for the diagnosis, which is very important. And again, in Addison's, investigation of choice and as well as treatment. So for primary and as well as secondary adenocortical insufficiency, what is the treatment? And you need to know about this Waterhouse-Friderichsen syndrome in the Addison's. And in pheochromocytoma, investigations and treatment. And in the thyroid-related disorders, treatment you will be learning in your pharmacology. But what is important in the medicine is diagnosis. There is a flowchart in the Harrison for the diagnosis of the thyroid-related disorders. That flowchart for the diagnosis is very important that you need to revise. Next, regarding the diabetes mellitus, what is that you need to revise is complications. Diabetic ketoacidosis, hyperosmolar non-ketotic coma, macrovascular complications, microvascular complications, dermatological complications. Next is you need to revise about MEN syndromes. MEN1, MEN2A, MEN2B, and MEN4. These are the topics that you need to revise in the endocrinology. And endocrinology being a small topic, you try to allot for 2 hours. And hepatology, you try to allot 1 hour. Okay. And hepatology, what is that you should definitely revise before going to the exam? Serology of viral hepatitis B, there is one table in the Harrison that you need to revise just before going to the exam. Acute, what will be the serology? Chronic, what will be the serology? Latent, what will be the serology? Vaccinated, what will be the serology? Cured, what is the serology? Immune, what is the serology? That you need to know. Next is ascites has been asked many times. You need to revise that. Next is complications of cirrhosis of liver, in which you need to revise portal hypertension and as well as the hepatic encephalopathy. Portal hypertension, mainly you need to know the treatment. right? And as well as in hepatic encephalopathy, you need to know how to diagnose and what is the treatment. So these will be the topics that you need to revise in the hepatology. So this will be your 5 to 6 days strategy that is required for revision in the medicine. And how much time you need to allot every day for medicine? Just allot 2 to 3 hours, not more than that, because you have another 19 subjects that you need to revise. So these particular topics which are definitely required to be revised, I'll be sending this on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. Please go through that and please follow the date-wise schedule of revision of these particular topics. And very important, not but the least, the current guidelines, the ACLS protocol, BLS protocol that you need to revise just before going to the exam. And try to look for all the images, right? Whatever the images that you have, please try to go through all the images that you have. Okay. And what is important at this time? Active learning is very, very important. Try to do the discussions if you're feeling very much anxious and panic, right? And time management is very important. Don't waste time. Don't give up at this last moment. Okay. Try to follow this particular strategy for the general medicine. Okay. Try to divide your entire day properly. Don't be like panic. Don't be like extremely anxious what to read and how to read. Divide the day. One major subject, one medium-sized subject, and one small subject. So in this way, if you divide the day, then it will be like very much peaceful to you, like what to read and what not to read. And try to do the self-assessment. You try to identify what is your strength and try to identify what is your weakness and try to correct whatever is this particular weakness, right? And in the last moment, handling the exam stress. So healthy lifestyle is very important in this last 5 to 6 days. Try to take a balanced diet, and very important is try to avoid carbohydrate rich diet early in the morning. Even on the exam day, try to avoid carbohydrate rich diet because that will spike your insulin levels and that will cause drowsiness. So try to eat proteinaceous diet just before going to your exam. And adequate sleep is very important in this last 5 to 6 days, right? And if anyone has the habit of doing exercise, try to allot 30 to 45 minutes of doing regular exercise. And relaxation techniques like meditation, yoga, deep breathing exercises, they are very much important, right? And take short breaks between the study sessions so that will avoid your burnout. And very important is try to maintain that positive mindset. Try to maintain that positive mindset. Okay. And next, not but the least, very important is it is not the success which is very important, right? It is the consistency, the dedication, perseverance, and as well as positive mindset, which is very important in this last 5 to 6 days. So don't give up in this last 5 to 6 days. Each and every step you take, every hour you study, that means you are getting closer to your goal. So please don't lose this opportunity. Please utilize this opportunity to grow and as well as improve. Believe in yourself. Believe in your abilities, right? And appreciate your strength. Completely stay focused. Try to maintain the balanced lifestyle in this 5 to 6 days. Try to avoid doing silly mistakes during the exam. And if you're feeling extremely stressful, go to your mentor, go to your loved ones, right? Just lie down over them. Try to express your anxiety. Don't keep your anxiety within yourself in this last 5 to 6 days, right? Put out your complete anxiousness with them. Put out your complete stress with them. Then you will feel completely better. And what is very important is in this last 5 to 6 days, visualize your success, right? You just visualize that you are giving the exam and all the questions, whatever you are doing in your exam are like completely easy. Whatever you have read, that is how you need to visualize. Visualize your dream branch. Visualize that you have cleared the exam very nicely. Visualize that you have got your dream branch and you are entering into your medical college of your own choice. Now, this particular mental image will keep you completely motivated and as well as focused. And please don't give up in this last 5 to 6 days. Definitely, there will be moments of doubt and fatigue, but never let them overcome your determination, right? You have to remember that the greatest achievements, they are born out of these toughest challenges. So that is the reason why stay with a positive attitude, right? Each and every hour and minute is very important in this last moment. Okay. So finally, right, I wish you all the very best, right? And stay positive. Definitely, you will come out with the flying colors. So, with this small note, I will just wind up this particular session. And what are the topics that you need to revise in the general medicine? I will just send them on my Telegram channel, that is Medicine Made Easy by Dr. Rajesh Gubba. So please revise those topics in a date-wise manner that I have mentioned. That will definitely helpful for you, your exam. Right? So thank you very much and see you after the exam with recall session.